If you've been concerned about unpredictable prescription costs, you are not alone. The good news is, for the second time, Medicare has put a hard cap on what you'll pay out of pocket each year for your prescriptions. This is absolutely a game changer, and I'm going to show you exactly what you need to know in 2026. So stick with me. Hi there, I'm Steve, your local insurance agent here in Christiansburg, Virginia. I've been helping folks throughout the New River Valley navigate Medicare for years, and today I'm breaking down the biggest changes coming to Medicare Part D in a way that's going to make perfect sense to you. Let's jump right into the most important number that you need to know. In 2026, the annual out-of-pocket cap for covered Part D medications is locked in at $2,100. Now, I know that might still sound like a lot of money, but trust me, this is a good deal. Here's what this means for you. Once your spending on deductibles, copays, and coinsurance for covered medications hits $2,100, as long as your medication is on the plan's formulary, your prescription cost drop to zero for the rest of the year. Now let me walk you through exactly how your costs are going to work throughout the year. The good news is Medicare has simplified this whole system, which honestly is a huge relief for all of us. You're going to move through basically 3 phases depending on how much you spend on prescriptions. The very first phase is called the deductible phase. You can think of this as your starting line. You'll pay 100% of your drug costs until you meet your plan's deductible. The standard Part D deductible for 2026 is going to be $615. While this is an increase of $25 over last year's amount, this is the maximum deductible allowed, which means that individual Part D plans can offer lower deductibles if they choose. Once you meet your deductible, you enter the initial coverage phase. This is where your insurance plan really starts to work for you. Your plan picks up the majority of the cost, and you'll be responsible for a copay or coinsurance. These amounts are determined by your Part D plan and can vary widely from plan to plan. You'll stay in this phase until you reach that $2,100 maximum out-of-pocket cap that we just talked about. And then you hit the part that I'm really excited about, the catastrophic phase. It's a terrible name for a happy time. This is where your cost sharing drops to zero. Once you hit that $2,100 spending cap, you pay nothing for covered prescriptions for the rest of the year. If you're someone dealing with high-cost medications, this is a huge protection for your budget. I also want you to be aware of the $35 monthly Insulin Cap that will be a permanent feature this year. For those in our community managing diabetes, this provides a crucial stability and peace of mind. Whether you're brand new to Medicare or you've had it for years, you still need to take action. The Annual Enrollment Period, or AEP as we call it, runs from October 15th to December 7th. Even if you absolutely love your current plan, you must review it every year. Your plan is required to send you an annual notice of change that details all of the changes coming for 2026. Pay attention to whether your medication is covered under a copay or coinsurance. If your medication is covered by a coinsurance, which is a percentage of the drug cost, it can be less predictable than a flat copay. And here's another change that could impact your wallet. The negotiated prices for the first 10 high-cost drugs will take effect in 2026. These include popular medications such as Eliquis, Jardiance, and Xarelto, to name just a few. If you're taking one of these 10 medications, you will want to be aware of potential effects on costs this year. Your most powerful tool is the Medicare Plan Finder at Medicare.gov. You can enter your specific medications and get personalized cost estimates for every plan available in our area. Along with your agent, make this site your friend. You should also know about the Medicare Prescription Payment Plan. It's a voluntary program that lets you budget your out-of-pocket costs by splitting them into monthly payments instead of paying it all up front. This plan is offered by your insurance carrier, and it is especially helpful if you have expensive medications that require you to pay high costs in January. So don't wait on this. Review your plan, know exactly what medications you're taking, and use these official tools along with your agent to ensure that you have the best coverage for 2026. If you have a low income, you might also qualify for the Extra Help program, which can protect you from penalties and drastically reduce your costs. Here's the bottom line, folks. The $2,100 Part D out-of-pocket cap can be a huge win for your budget. But I know that navigating your prescription plan can still feel overwhelming. and even small mistakes can really add up. If you're here in the New River Valley area, whether you're in Christiansburg, Pulaski, Floyd, Giles, or any of our surrounding counties, I'm here to help you make absolutely sure you're on the right plan. My guidance is completely free and there's never any pressure. Now that you understand changes coming to Part D, you might be wondering, how do these changes affect the choices between Medicare Advantage Plan and Medicare Supplement Plan? Well, that's exactly what I'm going to cover in my next video. So make sure to hit that subscribe button and ring the bell so that you don't miss it. Thanks for watching, and I'll see you on the next one.